introduce yourselves. So Maddie, would you like to start and just tell us your name and where you work and how long you've been a nurse?
For sure. Hello, everyone. So my name is Madison Cook. I am a new graduate registered nurse, and I currently work in Penticton Regional Hospital on a medical telemetry unit. And yeah, that's kind of the beginning. I live in Penticton, which is why I chose to work there.
Awesome. Thanks, Maddie. Hey, Robyn, would you like to go next?
Okay, hi, I'm Robyn MacDonald, and I've been a registered nurse since May now, and I work in Kamloops, BC at Royal Inland Hospital on a surgical unit with mostly vascular patients and some gen surg, urology, and gynae patients as well.
Awesome. Interesting. So tell us, Robyn, what the transition to professional nursing practice is like. What's that like? What's it like to be a new grad?
It can be a little intimidating at times, but I've been really blessed to work on a unit where there's so much support and help for new nurses. Um, I always have people to turn to ask questions, to say, hey, I'm not really sure about this, or can you help me with this? I haven't done this for a while, or maybe I've never done this. Um, so it is really nice to have that support, but it can just be a bit scary to think everything is on your license now. Um, the patients are really in your hands, and if you make a mistake, it's on you. You don't really have your clinical instructor or your preceptor to run to ask for, I don't know, support. Like, you just don't really have that person anymore. Um, but it is good. It's exciting, and you learn lots and you gain more confidence as time goes on. So it's kind of cool to see yourself stepping into that role that you've been working for so many years in school.
Yeah, interesting. Have you always felt supported?
Yeah, I would say so. Just because I did my preceptorship and my employed student nurse positions on this floor. So I kind of knew everyone going into it. So it has been helpful. I mean, there's obviously going to be people that aren't always the most helpful, or I don't know, necessarily supportive. So you kind of learn who you can go to and who you shouldn't maybe go to. Um, and you learn that pretty quickly.
Maddie, is what Robyn saying, does that resonate with you?
Yeah, it's quite familiar for me. I realize I didn't actually finish your first question. I am also 6 months into my transition, but my orientation was about 3 months long from May to the beginning of August. However, I was baseline during some points in that orientation when there wasn't adequate staffing. Otherwise, it was a supernumerary COVID position that was created, at least within Interior Health. But just back to kind of what Robyn was saying, it's quite familiar, especially I think what clicks most is saying who you can go to and who you maybe try to not, like you don't necessarily lean as much on. I do feel badly sometimes when you're putting more, you're going to one or two nurses maybe constantly, maybe at times, just a few more times than I think that there's some questions I don't necessarily want to ask them, but I need that reassurance from them. And that's putting a lot on them at times, especially because they're just another nurse and they have their own patient load. But I do appreciate anyone that gives me support. And I do feel quite supported on my unit as well. I didn't complete my ESN there, my employed student nurse, but I did complete my final fourth year preceptorship there. So I've been on the same unit since January of 2020.
I just want to go back to the point that you made about feeling like you're burdening the other nurses when you ask them a question that they have their own work to do, is I think the words that you used. What makes you feel that way?
I just feel like sometimes um, it's a repetitive question that I should either know the answer to by now, and maybe it just hasn't solidified. I also feel like it delays my practice at times because I need to do a certain task or and I just something like that, and I don't exactly know where to go. So I need to ask a question, but then I have to wait until maybe they're free um, and they have completed their trains of thoughts because I don't want to interrupt them frequently as well, because I know how often we're interrupted when we're trying to prepare medications, when just we're getting phone calls and we're like, we need that message taken because I'm in the middle of something. So I just think that sometimes I go to them a few more times than I'd like, but I, again, just need clarification or they know the answer, and I just lean on them for that support at times.
Robyn, do you think it's reasonable that Maddie feels that way? That she, feels like she is burdening the other nurses? Is that reasonable for a new graduate to feel that way, do you think?
Yeah, I think so. I mean, I understand the feeling that she's having because I think I get that a little bit too, but I think that senior nurses recognize that it is sort of part of their role to help support the new graduates and help them, I don't know, get comfortable in their role and in their position. But it I don't think that all senior nurses necessarily recognize that. So I think that's kind of what gives you the feeling that you might be burdening. And because I think there's a lot of burnout in the profession. So even when the senior nurses, they do really like to mentor or help the new graduates, they might just be having a rough day or a rough week, or they're just feeling really burnt out themselves. It can be really tiring for them to have to constantly be supporting someone as well as completing their own work.
So what do you do when you encounter someone like that? When you need to ask a question or you need to solve a problem, what do you do when you aren't getting where you need to go or getting the answer that you need? What happens next?
Um, I think for me, we have really excellent patient care coordinators on my floor. So if I felt that I wasn't getting the support that I needed from one of my colleagues, I know that I could always turn to the PCC. Um, or sometimes I'll try to figure things out myself. If it's a new or unfamiliar skill, I'll usually look it up on the computer, find all the resources that I need, and then maybe try doing it myself, or I could ask a different colleague. That's generally what I do.
Okay, how about you, Maddie? What do you do?
Well, during, for example, a day shift, I do turn to my colleagues, and I find that most of them are completely fine answering my questions. I don't know necessarily how they feel about it, but they do answer, and they are generally um, trying to help me figure out what I'm trying to do. So I appreciate that. Sometimes I do also connect with my patient care coordinator, but they are only on my unit Monday to Friday, 8 till 3 or so. And so then it comes to, well, what about the evenings? What about night shifts? What about weekends? So I remember an experience where I was a new grad on with two senior nurses, but they were senior nurses that sometimes I feel um, like I don't necessarily feel comfortable asking them for help. And in that just comes from maybe some of the previous interactions with them. But one time I recognized a difference in my patient's condition, and I, you know, did a couple things on my own, but I just needed another set of eyes. And I just stepped out of my shell a bit and did ask them for support. And I think for me, the biggest help there was an actual nurse staying with my patient, keeping an eye on them while I could go, get a blood glucose meter, things like that, get medications, call a doctor. At least I knew there was somebody with my patient at that time because the phones aren't in the room. So I think sometimes you just got to ask, even if you don't know how they'll respond, and hope that they understand your sense of urgency and where you're coming from. And if they don't, then I think I would connect with my supervisor on, for example, a night shift next, but I haven't ever had to escalate to that.
Hmm. So if you were talking to a new grad who's just like walking onto your unit for the first time, what advice would you give them, Robyn? What would you think, maybe top 3 things that they would need to know if they were coming onto your unit for the first time?
I think the first thing is know that it's okay to ask questions and it's okay if you don't know the answer. Um, I think knowing where your resources are, so looking up medications, making sure you're checking your compatibilities, um, new skills, looking up the procedures, that sort of thing. And the third thing I think would be just be confident in yourself and that you oftentimes do know the answer, but you're maybe just unsure of yourself or you're afraid that you're wrong or I don't know, but just having more confidence in yourself and your practice.
So some people say, Maddie, you've probably heard this before, that new grads are overconfident. Have you heard that before, that new grads are overconfident? What does that mean?
I've heard it before. I don't necessarily agree with what it from my perspective or from what I've seen. So I don't really know. Nobody's ever like said that around me. So I don't know where it necessarily comes from, but I could see it being just maybe you don't ever hear a peep from them. And I don't know if that portrays the confidence or if that just portrays shyness.
Yeah,
Um,
I know on my floor, the patient care coordinators say if you're not asking questions, I'm worried about you as a new grad because you should be asking questions.
So
Yeah.
if so when just talking more about that overconfidence, just taking that a step further. If nurses feel that way, senior nurses, but Maddie, it really doesn't resonate with you and it doesn't feel true, then
Mhm.
how do we bridge that divide? How would what would you say to the senior nurses who feel that way about new
I
grads?
would I would just like to know what they see and like what I'm doing that maybe portrays that, or if they're saying like, or if they came up to me and said like, hey, you look really comfortable, like how are you feeling, are you settling in, things like that, then maybe they could get that would establish rapport between the new grad and senior nurse, and then they could get a sense of how I'm actually feeling. um yeah, I wouldn't really know otherwise. I think that it's just all through communication. Because I mean, when I see somebody being able to complete their work and, you know, task manage or having good time management, things like that, I just think that they're strong and capable and someone I want to look up to and someone I hope to become. So I would like to see what they see in us.
What happens, Robyn, when new grads don't feel accepted on the unit where they work? I don't know if you've ever felt that way, felt like an outsider, but some new grads do say that they feel like outsiders on their unit. And um, have you ever felt that way? And what do you do to change that?
Yeah, I think it can be a common feeling when you're first starting out there because there's maybe a lot of cliques or groups on the unit and people are really close with each other. It's kind of hard to break into that when you're new. But I've found it as time's gone on, I've felt really accepted and welcomed into my unit. I think it also helps because I've taken a line on my unit, so I'm working with the same people all the time now. So I'm starting to develop more friendships, and we will go for drinks on our days off or do things together on our days off. So that really helps when you're having social interactions with people outside of work. It makes you feel like you're more a part of the culture and a part of the unit. Um, but I think it can be a bit uncomfortable for people when you first start out, when you're feeling a bit shy. You don't really know if it's a safe place necessarily. You kind of want to show your own personality, but I don't know, you might just feel uncomfortable. It's new, so it's always going to feel different. I'm sure even when you start out in your nursing program, there's a lot of new people there. It takes a while to make friends. It's kind of a similar idea to that.
What about you, Maddie? What do you think about the feeling that new grads have of being outsiders?
Yeah, I feel like I have maybe witnessed a little bit of one or two new grads that aren't as comfortable on um, my unit. They're maybe out of their new grad and still not necessarily comfortable from what I've seen, because you don't necessarily know what exactly happened during their transition or the nurses they've worked with. But I've seen them not come into work. I've seen them uh, change position like lines, and I've seen them relocate to maybe a different hospital even. And yeah, I just don't know necessarily what's driven that, but I think that that's very valid, that if you're not comfortable on your unit, or if you're not comfortable with how much you're working, you want to work less, you should just move down from, full-time, part-time to casual, so you can kind of manage how often you're working. And I think that if you just find that you need a change in scenery, I get that it's a big step. I also am nervous sometimes to go to other units, but I think that if you think it's what's best for you, you should do it. I personally have socialized on my unit, and that makes a big difference, being able to socialize. So I feel pretty comfortable with the nurses I work with. And I also get excited with some people I work with. I get excited to hang out with them. I've established some friendships, and I also hang out with them on days off. One time I went to breakfast after a night shift with two nurses I worked nights with, and that was just wonderful. I made everyone feel happy, and so it's important to try to socialize if you can.
So you've talked about some really positive aspects and camaraderie that can result, when you build these social interactions. But what's the worst part about being a new grad? What's the hardest thing that you've had to go through?
For me, it would be like having really sick patients, and you really want to focus on one person, and you still have four others that you need to meet their needs, get them their medications, get them their blood, things like that. But your one person is going down the rabbit hole. So, like, you do prioritize, but you have to work quickly, and you have to be able to think quickly. And yeah, just it's timely, and you don't always have a unit clerk to process orders, so you have to be able to just keep going and moving, and you miss some breaks sometimes. I think that's really tough for me at this point, and that we never reviewed what happens after a patient has passed away in nursing school. So to learn that paperwork and learn how that process goes, I've definitely had a few deaths, and I still don't exactly know the perfect process, because you haven't done it enough. But so I wish that was covered.
What about you, Robyn? What's been the hardest part of being
Um, I think, yeah, I agree with Maddie that having sick patients can be quite stressful. A lot of times with vascular patients, they're not the healthiest people to begin with. So you're dealing with a lot of comorbidities, and you can just have some really acute patients. Um, but I think the worst is the low staffing. And one of my worst days was when I was paired with a nurse who actually had less experience than me. And so, my partner wasn't necessarily someone that I could turn to for help, because she might not that she didn't have knowledge, but she was just new as well. So, and we were short, so we're trying to get through the day, and I'm taking an extra patient load. We just had lots of things coming up, but and we do a lot of complex wound care on my floor. And so I'm still getting a bit comfortable with doing the vac dressings that we do, because sometimes they can be quite complex and they're different on everyone. So it's a little bit of trial and error. So sometimes just feeling like I didn't necessarily know what I was doing, but I was just trying to do it to get through the day.
So how did you cope that day that you were working with someone who had less experience than you? What did you do? How did you survive?
I kind of just turned to other nurses on the floor, even though they were busy with their own tasks. But we were lucky to uh, have another nurse that kind of came on as workload a bit later. So I really leaned on her for a lot of support with the complex wounds that I was dealing with that day. Um, but yeah, I also find that having students is another difficult thing, because I often will have students and they're great because they're helpful. Um, but it's kind of a difficult thing to learn to manage having a student, or having a couple of students, even taking care of your patients, because you want to let them do things, but it also, like, it sounds weird to say because I'm still new, but they're also quite a bit slower than I've gotten to at this point in my practice. So it's kind of like, come on, and you're trying to like get things done, but you don't want to rush them and you want them to learn. And it's kind of just an awkward thing to be teaching students when I feel like I was just a student yesterday. So, but I think you learn a lot about, you can like learn things together. If they have a question that you don't necessarily know the answer to, you figure it out together, sort of thing.
Have you had to work with students, Maddie? What do you think?
Oh, I haven't had any students on my unit that I've been paired with. I do see like one, but she's paired with a different nurse. I have had to orientate um, twice, so not very often. But I found out that nurse had like way more experience than me. But I was excited because I got to share like the unit specific things. So as a telemetry floor, like NSTEMI protocols and stroke protocols, things like that, and where to like locate certain things on the unit. So although I didn't necessarily like they took the patient load, I just got to, different paperwork even, show them our paperwork and such. I found it interesting that Robyn, because you said you were paired with like another nurse. Like my unit has 3 RNs. So if we're short staffed, it's quite stressful, and it kind of happens quite often. Sometimes they usually can fill it from what I've seen, but I left my last night shift and there was only 2 RNs, and our patient care coordinator had to take some patients. Now, the only positive thing there was that our unit wasn't full to capacity, but my unit is currently expanding. So it will go, I think, from 13 beds to 21. So I'm kind of excited for that because there'll be an extra RN and an LPN. My unit doesn't currently have LPNs. So I'm excited to see what their scope is and how RN LPN dynamics work together. But just because if you're short staffed, then it's not so much pressure because you still have a couple new staff members. But I think
find it
if you work in
interesting working with LPNs because when I first started working on my own, I found they were pairing me with RNs quite a bit because on days you always have a partner and that's who you break opposite of and you turn to that person for help sort of thing. And I think it was probably just to support me. They were putting me on 2 RN teams. But then the first time I was partnered with an LPN, I felt kind of weird because I didn't really know their scope well enough. And like this LPN had way more experience than me, but there were certain things that she was coming to me for that I was like, I don't know, I feel like you know the answer better than I do, but I guess it was maybe just something that needed the advice of an RN or I don't know. So it's kind of different working with them and I like it. It's great because they usually are excellent and have so much knowledge to share, but it's just different. You just have to get used to it and I don't have a good enough understanding of the scope of the LPN that I find it can be hard.
well,
So
I see the
yeah.
scope paper, but I've read their scope before in nursing school, but it doesn't like ingrain until you're actually in practice.
Hmm.
You said, Robyn, that it feels weird or it feels different maybe to work with an LPN. What, if you had to try to sort of speak to those differences, what is different about working with an LPN compared to working with an RN in your experience?
I guess just that if I was working with an RN, they wouldn't have to come to me with any tasks for me to do necessarily. And if they were delegating things to me, it would probably just be so they could go on their break so we could stay on schedule, sort of thing. Um, and because then I would know if I was working with an RM that anything I asked them would be in their scope to help me with, or that they would have knowledge on that. Whereas that I just found that maybe I don't necessarily know what areas where the LPNs have more or less knowledge. Um, and then they're also delegating things to you as well. So we frequently get patients with continuous bladder irrigation on our floor. And so if their patient was clotting off, then I would be doing all the irrigating for them. Um, I'm always doing their IV meds, but then it kind of confuses me because they can do certain things with IVs, like saline locking them or getting them running again, but I just don't fully understand what they can and cannot do.
What would help solve that problem, do you think? Like what would create a context where you could collaborate better with an LPN?
I think maybe just if in our orientation they talked a little bit more about it, then I think I would come on to the unit and feel um a bit like more knowledgeable about their scope. Um, but it's not that I've ever had any issues working with them, it's just learning.
Hmm. Interesting. Yeah. I just wanted to wrap up here by asking you, maybe you, Maddie, first, how has COVID affected your life as a new grad?
Yeah, so I think to begin with that is because I got posted into like a COVID new grad line. So I had 3 months of orientation, which is exceptional compared to the 12 shifts or less that you normally get. So I think that's positive. However, because it was so new, um, certain things weren't clarified. So, like I said, although I was supernumerary, I was baseline at times. And it was so stressful in when COVID was first starting because I was still in my final preceptorship. So some of my nursing student peers had been pulled from their practice and others hadn't. And there was so much talk, and I just felt like some instructors did everything they could to get their students pulled because they didn't want to risk their students getting ill, and then others didn't feel that there was a worry. And so there was just a lot of like mishmash there, and the nurses on my unit were stressed. We were just learning about how to do it. Every time you came to work, you were just to check the website because the binder would have been outdated by the time you got to work, about proper PPE, things like that. COVID codes were really stressful. Like, I didn't actually have a COVID code before. I had a patient pass, but they weren't a full code. So I didn't have to like do chest compressions or anything. But the gowning up, the process, like who can go in at a time, putting a mask on your patient at that time. It was just a lot to take in. And it was like, you would only do it on the spot. They tried to practice them before, but not everyone got to practice because the shifts are all opposite. So some people knew how to do it and others didn't. And then just waiting for those results. And then what if your patient passed and you never found out those results? So it's just always you're always a little high strung waiting for those results. Fortunately, I don't think that I'm as affected as some of my like friends and other people that I've talked to, because all of my patients have come back negative. So what to do if you actually did have a COVID patient? I would still learn that. Like, I know that you'd continue the same precautions, but how that would look, and I think the stress on the unit could be a little bit different too. Yeah.
Robyn, how have you coped with COVID in your workplace, in your life?
So it actually brought about several changes to our unit because there are two surgical units at RIH, and the other surgical unit deals with orthopedics and neuro patients mostly. So once all of the elective surgeries, like the hips and knees, were all stopped, their unit actually was transformed into the COVID unit. And so then our unit started taking all of their emergent surgeries. So we became one huge surgical unit, seeing all types of surgeries essentially. So that was definitely a bit stressful for me when I first started, because I was still felt like I barely knew what I was doing with the types of patients that I already knew how to work with. And now they were throwing different kinds of patients into the mix as well. So it was a lot of learning for me to begin with. But shortly after, their unit started doing their surgeries again, so they were taking their service back. So that definitely helped, because that was still during my orientation, so at least I had a little bit more support when I was dealing with the orthopedic patients that I didn't necessarily know as much about. But yeah, and we did have like some new staff come over. They switched to our unit after the other unit was designated COVID. So there was just some newer staff, they were experienced, but maybe not necessarily with caring for vascular or gen surge patients. So that there was changes to the unit itself, but yeah, like Maddie said, there were just constant updates to the policies and the procedures. So it was really just about keeping up with things. But I think a huge factor of it was fear for me, because I think there was kind of a lot of, I don't know, like hype about everything, a bit of fear mongering maybe, because I hadn't been in the hospital for about a month or two from when my preceptorship ended to when I started. So I really had no idea what it was looking like before I went back to start working. So I think there was just a little bit of anxiety about that. And for me personally, like I moved out because of COVID. Like I was living with my parents during school, and I kind of planned to live there for a bit longer just so I could save up more and sort of get my finances in check before going out on my own. But COVID kind of expedited the process for me just because my dad is a bit older and like he just had surgery before things kind of picked up. So I just felt like I didn't really know what the situation was, and I didn't really want to be bringing home my germs to anyone else. So it was the new transition for me in a couple of ways.
Yeah, it's been a very significant time of change, I think, for nurses all over
Mhm.
the country. There's no doubt about it. Maddie, what has kept you in nursing through all the pandemic? And the transition can be really tough. And like, why do you stay?
Well, I'm still like I'm eager to learn. So I don't think that things that bring me down, I'll just try to like um think that the next day is a new day. And I think patients really do it for me. So I have lots of patients that, crack jokes with me and they say positive things. I have been told by patients that I'm a great nurse and I've done really well. And I think something that's funny about COVID is that because I wear a mask, I wear like eye protection and I wear a hair covering at work. They don't know my age, so nobody really no patients really question me as much as necessarily when I was a student. um so maybe there's more trust with them or something, but uh they just I really am satisfied by um charting well and making sure my patients are safe and that I've done everything I honestly could for them. And it just makes me feel pretty whole doing that. So at this time, I'm not, that you don't hear the words like you're not jaded yet, things like that. So we'll try to keep up that optimism and that smile for them.
What about you, Robyn? What keeps you going?
I find the camaraderie between the nurses is a big thing. Um, but yeah, I also like making my patients feel better or seeing them improve to where they're going home, and they're well again. Um, I like that there's so many opportunities uh, ahead for me in my career. Um, there's many nurses on my floor that are doing courses for other units. Several of our nurses go to ICU or recovery after. So it's interesting for me to watch as they're kind of going through their courses and they're going into their practicums in other areas. So I think that helps keep me optimistic that one day that might be me, trying something new and learning more. So yeah, I think and I think it also just feels great after you conquer like a crazy day and you're like, wow, I can't believe I made it through that day. There was so much going on.
Mhm.
Yeah, I think there are definitely times where you actually do more than what you think you can do. You can
Hmm.
cope with more than what you think you can.
Mhm.
Yeah, yeah, it's true. Well, I think you both are an amazing addition to the nursing profession, and I want to thank you both for your time and your thoughtful and articulate responses. It's very much appreciated.